We are here today with Dr. Michael Groat from Silver Hill. He is the Chief Clinical Officer over there, talking about treating psychotic disorders during a global pandemic. This is a population that we certainly service quite a bit over at the dorm, as does Silver Hill. And it's a population that I haven't really seen talked about all that much during the pandemic. So we're excited to be doing this today. And Michael, welcome. We're super excited to have you. Just as far as some housekeeping and introductions, let me go ahead and introduce my partner, Dr. Amanda Fialk, who is our Chief of Clinical at the dorm. She'll be co-presenting with Michael, as well as Sarah Harte. She's our director down in DC. She'll be managing the Q&A today. This will be roughly about a 35 to 40 minute PowerPoint presentation. Followed by a Q&A. So during the presentation, please feel free to use the chat box for any questions that do come up. We should hopefully have time to answer all of those questions. If we're not able to, we'll be following up with an email with all of our direct contact information to certainly keep the conversation going. Lastly, we just started a YouTube channel to share these roundtable conversations that we've been having. We've actually had 13 in the past 3 months. This will, of course, be one of them. So please look out for that YouTube channel to be able to check into any of the previous roundtable and certainly upcoming ones that we have as well. So with that, I'm going to ask Meredith to cue the slides. And Michael, I'll turn it over to you to get us started.
Okay. Thank you, John. Thank you, Amanda, Tracy, Meredith, and all those who helped assemble today's webinar. And also thank you to Susanna Lewis on the Silver Hill side. And looking at the names of people who are participants today, I recognize many faces and names, and I'm thrilled to see all of you here and look forward to your questions and comments after we do an initial presentation. So I'm very excited to be here today and share with you some thoughts on working with individuals who have formally diagnosed as psychotic disorders and what that means for us during the COVID crisis. So, as many of us know from our lived experience, both as people in society and as clinicians, this is an unparalleled time for us in many, many different ways. And, zooming in for a moment just on the COVID crisis itself, it introduces to all of us, unprecedented levels of uncertainty, such as, will schools open? When will they open? How do we travel safely? A lot of different types of fears around what does this mean for the future? Anxieties regarding, when will a vaccine develop and will it be effective? And how many people might we lose in the interim period? And one thing that we know is that people who are vulnerable to psychotic experience face particular types of susceptibilities during this time. I want to talk a little bit more about that. So, oftentimes when we think about psychotic spectrum disorders, the more positive symptoms or the more active symptoms, such as hallucinations or delusions, often get the most attention. And certainly those kinds of experiences, can be worsened during times of stress, such as we see in COVID. In fact, here at Silver Hill, we have an adult inpatient unit. We also have an adolescent inpatient unit. And in our adult inpatient unit today, which has 15 patients, about 8 individuals are there now who are, you could talk about in the throes of a psychotic decompensation, often mixed in with mania and mood instability with psychotic features. When you start looking more closely, though, and one of the things that my admissions team and I are doing is we're tracking how many people are coming into us whose family or the patient who is referencing COVID as a stressor in that person's life. And right now, our estimates are about 1/3 of patients who are admitting are in some way or another connecting the increase in symptoms to COVID. So they're citing things like the prolonged periods of isolation. And one of the things that we know is referenced here is that the social support and social connection is particularly important for any of us, but it's also very relevant to individuals who already, by nature of the illness, if you think about some of the negative symptoms of psychotic spectrum disorders, such as kind of withdrawal, some of these negative symptoms of withdrawal and isolation are only worsened during a time when there is a lot of sheltering in place. So we'll move on to the next slide here. You know, if you combine the stressors that people face and the way those stressors can activate further, can further escalate symptoms, we also know that many people have their own risks of increased comorbidity. In other words, that the experience of living with mental illness and oftentimes the medications used to address some of the symptoms of mental illness together, combined with lifestyle factors, we see a number of individuals who are at increased risk. And we're going to talk in a minute about some of those risks for them contracting COVID and having adverse health outcomes because of getting sick with COVID. But there's also increased risk factors of even being introduced to COVID. You know, depending on the sector in which we work, some of us work more in the public health sector, interfacing with people who are homeless. Clearly, there is enormous risk for people who are home unstable. And then you add to that the difficulties some individuals may have really registering and making sense out of all the sheltering in place, all the infection control measures that we have to take. And that and there's a few people here who I'm familiar with, and we have a residential program called Michael's House that's dedicated to treating people with psychotic spectrum disorders pretty much exclusively. And one of the things that we have seen are that there are individuals who can associate wearing a mask with a sense of not being able to breathe. And then that links to them to a whole range of things. For some people, I was talking with an individual a few days ago, because I lead groups on the inpatient units in our residential programs, talking with a young man who's in the throes of psychosis. And for him, wearing a mask is linked to a larger conspiracy of suppression and he takes it in a very concrete way, that wearing a mask is to muffle him so that he cannot speak. So that's an example of a more literal interpretation of a mask. And we can see, because one of the things about schizophrenia, and schizophrenia is actually a compilation of syndromes. One of the things that you can see with something like schizophrenia is not only the problems in living and some of the more active symptoms, but you see a lot of different cognitive difficulties, difficulties with executive functioning, memory, a tendency at times to be quite literal and overly concrete. So these present new challenges in terms of how do you engage someone, meet them where they are in terms of their particular strengths and limitations, and help them maintain safety. So in our Michael's House program and also our inpatient unit, we do a lot of extra precautions around infection control. And we've had to make accommodations. For example, this young man who, for him, wearing a mask is part of a conspiratorial, paranoid experience. So, I've met with him in a room where we sit at a distance, maybe about 8 feet. And that's a way of trying to accommodate and connect with him while we're also trying to work with him medication-wise. So as I mentioned, there's a higher degree of medical risk. As many of us know, there are increased comorbidities dealing with endocrinological issues like diabetes, heart disease, and as we know, a number of people with schizophrenia or psychotic disorders actually find smoking very soothing and comforting, and we have a high proportion of patients who smoke. And one of the things from some of the data we've seen on COVID infection is that individuals who have underlying heart disease, who are smokers, and who may also have obesity are at increased risk. And so that covers a fair number of individuals that we treat, and I think our public health system treats who have mental illness. And then you combine that with difficulties individuals may have connecting with the healthcare system, lack of trust in a healthcare system, insufficient attention to their needs in the community. And we know that there are enormous disparities and inequities in terms of access to resources. And I think this adds to the complexity and the challenges of providing sufficient support to individuals during the COVID crisis. And just one very concrete example is, if someone is in need of monthly shots, Prolixin or other kind of antipsychotic medications, it means they have to go to a location, they have to know how to engage in the infection control protocols, and that there's potentially increased risk in that. And there's also the increased challenge of, getting people to stay connected to their treatment providers. And I think with the real explosion and advent and adaptation of the use of telehealth, telehealth, and I'll talk a little bit more about this, can have some real advantages, but it also can present some real challenges in connecting with individuals. I'm thinking of a person who we're working with here, who experiences talking through the phone in a virtual manner as a form of unhelpful monitoring, and feels very anxious and scared of it, and that he's going to be watched. So it presents, so on the one hand, we can talk about telehealth being an enormous help, but again, the individual meaning it has for the person can vary. So we have to be particularly flexible in finding ways to connect. Oh yes, we're on coping skills. So I can say with a number of patients we're working with, while there are some who find doing a session with them by phone is, it can vary by age, but it also can vary by the kinds of difficulties someone might have. What's interesting is we have observed a number of individuals who have actually found virtual sessions a little bit more freeing, because during the call, they might turn off the camera if they find direct contact too difficult, or some individuals just prefer to have a Zoom call without the camera on at all. And we've actually found that we've been able to connect with people quite successfully that way. One of the things that we like to do here is in our residential program, we have a lot of cooking, and normally for the cooking group in our Michael's House program, which specializes in psychotic spectrum disorders, it entailed a trip to the grocery store and putting together a meal. We're not able to do that right now. And so, in fact, we also had the Michael's House program connect with a peer recovery support group. That's also more limited. So the social networks have changed, and there's a lot more internal house-focused work being done. And we are, continually trying to be creative around ways to foster socialization on our own campus. And so one thing we've done is we've had a number of staff volunteer to come in and lead a social type of event. So just as one example, I've been leading bingo tournaments, and we have prizes that we offer. The Michael's House program, by the way, did come in second place last week, and they won an ice cream party. So I'm going to be delivering ice cream to them tonight. And I just use that as an example because last weekend we had one of our staff members who does fly fishing come in. We have a stream here with a pond, and he came in and taught a number of Michael's House residents fly fishing, which they enjoyed. So we're finding, so even though we can't take people out into the community, we're looking at new ways to connect them socially. So one of the things that is most near and dear to my heart as a clinician is to think about, and this is something I have been spending a lot of time on in the past several months. One of my mentors and colleagues at Menninger, John Allen, he is currently writing a book on trustworthiness in psychotherapy and therapeutic relationships in general. And he and I are doing a grand rounds together in 2 weeks. And one of the things in reviewing the literature with him that we've been doing over the last 6 months is there are over 1,400 today, over 1,400 different brands of psychotherapy. And if you look at some of the core evidence-based models, cognitive behavioral therapy, ACT, acceptance and commitment therapy, DBT, et cetera, even as they're adapted to individuals living with psychosis. In terms of outcome on measures of symptom relief, they're relatively equivalent in terms of, they're all effective in different ways. And what is actually, if you look at the research closely on what is most impactful and outcome, is the therapeutic relationship. And particularly the literature now is pointing very strongly in a direction, and I love the point made earlier about personalizing care, that the more we can personally tune in to the person in front of us, knowing their cultural and racial identity. And the other day when Meredith and I were talking about this presentation today, I've been thinking not only about what it means to live in the COVID pandemic, but what does it also mean to live in a society where the color of my skin for so long, for so many, as a daily factor in terms of how they think about what it means to be in the world. And then you compound that with layers of navigating the mental health system with mental illness. I think that we're in a more complex, sophisticated domain then of thinking not only about COVID infection, but how do we address inequities around race, ethnicity, gender, sexual orientation? Because certainly we all know that the patients we work with are not defined by psychotic disorder alone. That may be an aspect of their experience, a very important aspect of their experience that massively impacts their lives. However, there are other aspects of their humanness that I think can get lost in the face of a pandemic, and I think are really important to keep in our minds. And particularly as it pertains to our trustworthiness, the literature, if you look through the literature, there's actually not a lot of research done on what makes a therapist trustworthy. Interestingly enough, there's a lot of research done on common factors, and I could talk about that for quite a while. But basically, trust in relationships, therapeutic relationships, comes down to perceived competence, which is derived from skill and a framework of understanding people that they can understand and relate to. So for an individual living with psychosis, a way to understand my experiences of psychosis, not only in relationship to my neurobiology, which is often how we think about it, but as well to think about the problems in living I might have, to think about how in the face of my psychosis and my experiences, that I may feel like a failure, which is something I hear from patients. There's a woman I'm working with now with schizophrenia, and she said to me this week, because we were talking about COVID, she said, I have experienced the loss of normalcy for years. And what I see happening in the world is it's like it's catching up to what I've experienced. She said, I've been out of reality for 2 years now. She was in and out of hospitals for 2 years. We finally gotten her to a place where she's stable. And so I think, for her, the connection with what psychosis means to her, what it's meant to her sense of identity, what it's meant to her as a woman, what it's meant to her as an Hispanic woman, all these different elements. And so I can bring in a certain kind of skillfulness around acceptance and commitment therapy and other modalities and inform my work with her, which is the competence piece, but also connecting with her with respect, love, a sense of genuineness, and really being able to understand the nature of her attachments and what that means in our relationship. So I think that the COVID crisis, although it's very evident and we'll be living with it for a while, presents us a new reality to adjust to, not only around COVID, not only dealing with psychosis, but dealing with the individuals with psychosis who are in need of being able to trust us and to continue to find our humanness throughout this pandemic and throughout a time of a lot of tumult in our society. Next. So I've been referencing a number of these things already. I'll just add one more piece that I haven't mentioned so far. Just yesterday, I was meeting with some of our team, in Michael's house. And one of the challenges, we have daily rounds and we review the status of everyone every single day. And we have a number of people who are taking Clozaril, which a number of you know is a form of an antipsychotic, and it can be very helpful for a number of people. However, there can be some symptoms related to Clozaril that sometimes are hard to discern whether it may be COVID related or may be related to Clozaril. So that's an ongoing discussion. Our internal medicine department is always looking at this and thinking about it. We see people with, we monitor all staff and all patients here twice a day. Well, actually, all patients 3 times a day, have their temperatures taken, all staff twice a day. And we do see temperature fluctuations in our Michael's House program. And sometimes it's hard to discern whether that 100-degree temperature is an early warning sign of COVID, or shortness of breath is related to that, or if it's something else. So this makes our job a little bit more complex. But we continue to offer the type of clinical programming, and as I mentioned before, we're continuing looking for ways to be creative in providing social opportunities. We know socialization is so important, and maintaining the consistency in the structure. All are things that help people stay safe, continue to allow us to be trustworthy providers. And I'll just end with this, that one thing I have learned over time working with people with schizophrenia in general is that it can take some time to really learn the degree to which someone may experience difficulties with thinking, hallucinations or delusions, and that I've seen a number of people now who are very good at masking or hiding the extent of their difficulties, and I think with COVID that can make it a little bit more challenging. And so it takes I the other day met with a young man who's very, very paranoid, and he told me he didn't trust me. And I said, well, why would you? You don't know me yet. And is there anything that would help you trust me? And, this is the guy that, wouldn't wear a mask. So one of the things that I did to adapt to him was to sit across the room 8 feet from him without a mask. So he could see my face, I could see his face. Of course, the room had plenty of ventilation, and it allowed him to feel a little bit more trusting. So I hope I provided you some helpful examples, and look forward to discussing this more.
Thanks, Michael, so much for that introduction and so much important information. At the dorm, we're seeing a lot of the same of what you spoke about in the first half of the presentation. It is, to say that these are surreal times, I think doesn't really do it justice. What is going on in the world right now is, in so many different realms of the world right now, is overwhelming, is distressing, is anxiety provoking, and our clients are certainly more vulnerable now than ever. In particular, with this diagnosis, what we are seeing at the dorm is increased anxiety, increased stress, increased symptoms of psychosis, definitely an increased need for support around medication compliance, especially on an outpatient basis, and especially when our clients have decided to shelter in place with family. You would think that actually when sheltering in place with family, that there would be more of an increase in medication compliance because you have additional supports around them, versus clients who are sheltering in place alone in an apartment or living on their own outside of the family or with roommates. But it's actually our clients living with family members who we've really had to keep an eye on, because I think the whole system has a little bit of resistance to medication, and really working with the families on understanding the importance of medication has been really important during this time as well. We've also seen some really unique challenges with Zoom and online platforms with this particular population, as opposed to some other diagnoses that we work with. Family discord. We work so hard at the dorm in helping our young adult clients to individuate from their families and to live independently. And now many of them are going back home to shelter in place in home because they don't want to be living in their own apartment, or because their families don't feel comfortable with them living on their own in the midst of a pandemic. But when going home, the opportunity for stress within the family system has heightened once again. So the discord that's happening day to day in the home around the dinner table is something that we're needing to keep an eye on and really intervene with. On the flip side, we've also seen some really amazing opportunities for our clients to reconnect with families in a different way, and for families to really get to know their young adult children and to get to understand their diagnosis, because they're living with them for the first time in some cases in quite some times, because their young adult child might have been at college for a year before having a first episode, and then went to 2 or 3 different hospitals, and then to a residential treatment, and then came to us. So it's been maybe years since they've actually got to spend time together and get to know each other again. So there has been some really good opportunity, and I think it's always important during stressful times to also focus on areas of opportunity and the positives that we're seeing coming out of this, and not to lose sight of that. So in response to coronavirus and the unique challenges of either virtual treatment or a hybrid treatment model, we've had to adjust the way that we do treatment a little bit. And there's been certain areas where we've certainly had to increase the level of support that we provide. One thing that we did right at the beginning of sort of switching into a virtual platform, and which we're maintaining now in a hybrid platform, is that we have twice-a-day check-ins for all of our clients. One in the morning, right when they wake up, and one at night, right before they go to bed. And this check-in is done by their coach, who is a licensed clinician. And the morning one is really to help our clients to get the day started and to set intentions for the day, and to create to-do lists for the day and little reminders for the day. Our clients who struggle with schizophrenia tend to struggle with routine and organization, and just, creating lists as simple as, so many of our clients are even forgetting to, when you leave the apartment, you must leave with your mask. So creating little to-do lists and putting them on their door and watching them as they check off those to-do lists in the morning as you're doing that morning check-in. Medication compliance in the morning. And then at night, a review of the day. What worked for you today? What maybe didn't work so well but can definitely work better tomorrow? And then just accountability around sleep hygiene and nighttime medication. As I said, we've had to increase our parent support during this time, especially for clients who are back living at home after not living at home for quite some time. Parents need to be reminded gently that just because your young adult child, regardless of their diagnosis, is living at home, that does not mean that you cook all their meals, that you do all their laundry, that you nag them to clean their room every second, that you do the homework for their online class for them. They still need to have the autonomy to do these things on their own. And when you're doing those things for them, you are robbing them of the opportunity to master some of these milestones that they need to be mastering right now so that they can feel good about themselves. We've also increased our health and wellness programming, whether somebody is participating in treatment in a hybrid model or completely virtually. Being at a computer screen as often as we are at computer screens right now is exhausting mentally, it's exhausting emotionally, it's exhausting physically. It's important to get up, to move, to meditate, to do yoga, to exercise. So we've really purposefully created a treatment schedule for all of our clients where there are health and wellness opportunities throughout the day, whether they're doing these things virtually in a group format or one-on-one with a health and wellness professional. That is their choice, but we do feel like it is an integral part of the recovery process. Weekends are a time that we've really amped up support, and not clinical support, fun support and social support, having fun virtual socialization activities on the weekends. We've done talent shows, we've done virtual proms, we do one of our clients, their favorites, I should say, and we've had repeat occurrences of this activity, is pet show and tells. When we're on site, we can't have all their pets come on site because of allergy restrictions, but on Zoom, anybody's pet can show up. So we're getting to meet all of our clients' cats and dogs and snakes and guinea pigs and many other different types of pets that they own. And it's great. It's a wonderful way for them to connect to each other and to laugh and to have fun. But the weekend activities are key. I think in the coronavirus world, clients who are diagnosed with a psychotic disorder are really missing out on what we call kind of micro contacts that they have throughout the day. Those seemingly little contacts where they might go to the corner store and pick up a juice, or they go to the deli to pick up a sandwich, and it's always the same deli and it's usually the same corner store, so they get to know the people working there. And just seeing that familiar face and saying hello, it's soothing. And not having that all of a sudden, those little micro contacts and those little opportunities for connection and communication can be traumatic, and it can make somebody feel very alone in the world, and the world is scary right now. So we want to try to create opportunities for those micro connections in addition to the group connections virtually as much as we can. We have a clubhouse at the dorm where downstairs it's just a big room where clients can hang out and can play pool and ping pong and eat. And when we were going virtual, our clients said to us, well, we need to create a virtual clubhouse. It's great that all the groups are going to be virtual. It's great that all of our individual sessions are going to be virtual. But what happens when we want to go to the clubhouse and hang out? So we took our clubhouse and we created a virtual platform for that too. So throughout the day, they can check in to the virtual clubhouse and hang out and do virtual card games and virtual board games. And, you know, that's an example of how important it is to listen to your clients. They tell us what they need if we listen. And if we accept their feedback and we create safe venues for their feedback. And that wasn't something that we had thought of doing. And that's something that's been hugely impactful for our clients, especially our clients who struggle with schizophrenia and really value their card games between sessions. You can move to the next slide, Meredith. Thanks. So this is just a little sample schedule of what a day in the life at the dorm might look like. And as you can see, from 8:30 in the morning until 9 p.m., we're trying to keep our clients as busy and as structured as possible. Having that structure is important. What we say to our clients is that we want to keep your life as it was pre-COVID-19 as similar as it can possibly be to the way that it is during COVID-19. The venue that you're participating in the activity might look a little bit different, but let's try to keep the overall structure the same. And the next slide. So here's some tips that we're giving to our clients and also to our clients' families in terms of navigating COVID-19 while also struggling with a psychotic disorder. First and foremost, it's so important to take medications exactly as prescribed and not to stop taking medications or change the dose of medication without medical guidance. Our clients have been, for the most part, really, really good about that. I think it's been difficult for some of the parents to tolerate some of the side effects that they see, and they get tempted to play doctor and say, oh, it's okay, take a little less. So really, really educating them on you can't do that. If you're concerned about something, let us know and we can schedule a call with the doctor, but let's let the doctor be the doctor and you be the parent. And if those changes need to happen, the doctor will make that decision. We want your feedback. We want to know what you're seeing. But because their kids haven't been living with them for so long, they're not used to necessarily seeing some of the side effects of the medication. And I think it's hard for them to tolerate it in some senses. Again, as I was saying before, the pre-COVID treatment plan and schedule should really look the same as the COVID treatment plan and schedule. So consistency and uncertainty during a time of stress is really invaluable, and during a time of uncertainty is really invaluable. I think human beings have a general intolerance for uncertainty, and we want to make life as consistent as is possible during this time, while at the same time validating that the world feels very unpredictable right now. Last on this slide, I want to talk about alcohol and illicit substances. Again, many of our clients, they've been through treatment and they've been through a lot of treatment, and they understand that mixing alcohol and marijuana with their psychotic disorder or with the medications that they're taking for their psychotic disorder does not end up in a good place. Now they're home, some of them, and their families are having dinner and there's wine at the dinner table. And we've had a couple of instances where family members have said, it's not that big of a deal. You can have one glass of wine with me at dinner. So again, it's really educating the families about the importance of this, because that can be the beginning of a slippery slope downhill. Taking care of self. So practicing stress management techniques, yoga, mindfulness, meditation, breathwork exercises. For our clients who struggle with a psychotic disorder, with schizophrenia, there can be varying degrees of being able to tolerate some of these activities. So we really have to be mindful of starting where the client is at, getting creative. We have some wonderful health and wellness professionals on site here who are able to really create individualized health and wellness treatment plans and routines with our clients based on where they are at in their own process. Some of our clients can tolerate doing an hour of yoga. Some can tolerate 5 minutes. Some can tolerate doing a more intensive meditation session. Others, 1 minute of meditation is enough. So it's really understanding and listening to your client and where they are at in their own process. Sticking to daily routines, eating a balanced diet. When we are on site here, it is much easier for us to help our clients in this regard, especially when we're here, 100% and not in a hybrid manner, because we have breakfast, lunch, dinner, and snacks on site. When we switch to a more virtual or hybrid model, that changes. And it's really important for us to be helping our clients who struggle with ADLs, and ADLs can be very difficult for somebody with a psychotic disorder, to help them to remember to eat and the importance of eating balanced meals. For some of our clients, this means that we get meals delivered to their homes and to their apartments, especially if they're living on their own. That we eat meals virtually with them on the days that we are virtual, because not eating all day long and then all of a sudden it's 6 p.m. and your blood sugar is low and you're feeling angry and you're feeling groggy can heighten symptoms and can heighten stress and can heighten anxiety. So we've had to be creative in helping our clients to remember to eat. Physical activity. We're doing virtual walks. We're doing virtual scavenger hunts. We're doing virtual bike rides. Some of our clients have done, cameras off, obviously, just earbuds in. But just getting creative with it. You know, scavenger hunts have been great because some of our clients who struggle with schizophrenia don't love exercising. They feel uncomfortable in their bodies and they don't like the way the medication makes them feel. But you set up a scavenger hunt that requires them to walk, you know, about a mile to different places around the city to look for things. And then there's a prize at the end, and then you can get your exercise in. So, you know, Michael, I think you mentioned the word creativity a lot when you spoke, and I think creativity is the name of the game, and that we have to be flexible, that we have to be creative, especially during this time right now. Yeah. Maintaining good sleep hygiene, our end of day check-in certainly helps with that. Staying connected to others, whether that's people in treatment, out of treatment, having fun, laughing. There's something so cathartic about laughing and just having fun. And any time that we can create opportunities for laughter is, we need to capitalize on that. And limiting media exposure. We're really telling all of our clients, if you must check the media, pick specific times of the day and hold yourself accountable to sticking to those times. There's no need to be scrolling constantly online. With that, I want to thank everybody for coming, and I want to make sure that we get some time to talk and to answer questions. I know that Sarah typically is the person who fields our questions, and we want to hear from you all.
Can I say one thing?
Yeah, absolutely.
So one thing I just love is in listening to you, Dr. Fialk, I just hear the synergy, you know, thinking about a continuum of care. We have, in our setting, we have this inpatient level of care, the most intensive level of care with 24/7 nursing, and we have this residential step down, and then you have this wonderful world of community integration. And I just hear all the kind of resonance between, you know, what we're seeing and what we're working with and what you're doing in the very creative ways you're doing it. So I had this fantasy that you had the virtual prom and the virtual bike rides, and we should just get together and have a virtual bingo tournament, and we can all have fun together.
Set up some type of a virtual league where we all do stuff together.
And Pasadena Villa, and yeah.
That's what I was going to say, Dr. Groat, is I'm sure there's some other programs on this call that might be interested in. This could be a wildfire, a thing that could take off like wildfire. So I hear you. Yeah, that's cool. And thank you. You know, I think the kind of approaches to managing each individual set of symptomology and unique challenges deserve a little bit of attention each week, and I think by practitioners to think about what does all this mean for people who have these types of symptoms. And Michael, I wanted to just say thank you too for acknowledging the kind of what people are referring to as the two pandemics we're living through right now, one being the coronavirus pandemic and the other being racial trauma and what it's like to be a person of color, and particularly Black people in the United States, and just the burden that people carry. And then the trauma of navigating the mental health system in that process, and healthcare in general. So really appreciate you highlighting that. So I wanted to open up to questions. We have about 10 minutes or so now. So if people had thoughts, curiosities, we'd love for you to put it in the chat or turn on your microphone and share. I also want to recognize that Michael was talking about the YouTube link. So thank you for your curiosity about that. We're going to include the YouTube link in a follow-up email to all of you so that you can see previous roundtables in case you've missed things, and can check out the recording on YouTube. Michael, I'm curious, you had talked about the use of masks and being creative about, you know, understanding what that means for different clients and the interpretation that they have around those types of behaviors. I'm curious about what y'all are thinking about as time just goes by, managing the first phase of responses, to coronavirus and the guidance that we're getting from CDC. And now the guidance isn't changing that much, which is good. Actually, I think it means that there's some consistency in understanding this virus. But just thinking about forecasting a little bit into the future, are you all having any creative ideas or strategies that you're tossing around to think about how to maintain this over long term?
Yes. One of the things that, I've cited some examples of people for whom a mask takes on, the experience of using a mask can be part of the illness that they have. However, I do have to say that one of the things I think a number of on this call would hold as a shared value is looking at, how do we empower people to be part of solutions and to help enrich the community and keep communities safe. So to that end, I started a work group, and it's called the Community Safety and Responsibility Work Group. And it's set up as an aspect of the COVID Incident Command Team, because we report to them. And it's a group of patients and staff, and we think together around how do we maintain safety and have a sense of responsibility and accountability. So some of the patients from our Michael's House program are part of that committee. And, they're at a place where, they're more stable and are active participating members. And so they've been able to actually engage their peers and talk about ways that we can successfully engage peers around, things like mask adherence. And so it's actually helped improve the use of masks above and beyond staff reminders. So that's one step we've taken. I'm not saying it's 100%, but we've made some gains with that, is by really getting everyone to be part of the solution. And we developed a brochure, a laminated brochure front and back with a lot of pictures on it of kind of key things to know during COVID. So what it means to go to the dining room, what it means to go to the gym, what it means to ride our little bus around campus, what it means to have people drop stuff off for you, what it means for mealtime and how you space each other out. And that was actually something that came from the patients. They did some research together on things that they thought would be helpful, and we've been using it. And I think it's helped with our Michael's House patients. So I think and I've also been, when I meet with patients, this is thinking psychologically now, I've talked with folks and we have discussions about the loss that I think we're all facing around the former reality, the loss of, at least in my lifetime experience, the loss of innocence around being able to live without fear of a pandemic. That's a new experience for me, and I think for many of us. And so part of this is being able to name and acknowledge, we're going through a collective loss, and then yet how do we also adjust to that, to this new reality, and how do we form a community that's safe? How do we form a community that's connected? So just last week, we were discussing group therapy. All of our Michael's House patients have what's called a primary group. They meet with a therapist every week, and they process their week as a whole. And, it's complicated because at a very human level, people want to see each other's face. And so we've been wrestling with how do you make that happen in a group? So we've been holding groups outside where there's social distance and we can take off the mask. We've been using our gym, where it's a very large space with a lot of ventilation. And we have chairs set out 10 feet apart. We measure. And, as a way to try to foster connection. So I think these are really unprecedented times for us. And I think, as Dr. Fialk was saying, creativity is so essential.
Yeah, and client input too, I think is a really key component there. Yeah. I think, Ellen, I might have seen that you were turning off your microphone. I don't know if you had a thought or a question that you wanted to share.
Well, I was just thinking that some of them apply to us as well as the patients. I can't tell you how many times I've showed up places without my mask and had to drive all the way back home to get it. It just made me chuckle that we're not immune to a lot of these things ourselves.
A very unique experience about living through this at the exact same time as our clients are. So I hear you on that one. Somebody else was about to say something.
One of the things that that we experienced as more of a transitional or outpatient treatment provider is that some of our clients had gone into places like Silver Hill and Michael's house pre-coronavirus.
Yeah.
So they entered Silver Hill when the world looked normal, and then they got discharged in the middle of the pandemic. So when they left, the world did not look the same as when they entered treatment. And helping them to leave treatment and enter a new world, it's a double transition. They're leaving treatment and the safety of treatment, because people feel very safe and connected in inpatient treatments. So they're experiencing that transition. And then they're transitioning to a world that does not look the same as it did before. And that's been really complicated for some of them to navigate, and triggering.
That's a good point. You know, I've been struck by maybe about 10% of our residential patients. And by residential, you know, we're not a longer term program like Cooper Reese or other facilities or even the dorm. You know, for us, residential is about 6 weeks. We've had a number of people choose to stay on longer because of this issue. They're anxious about leaving. They feel safe here. There's a sense of being well taken care of. We've been very, very fortunate in the past. Since March 1st, we've only had 2 COVID positive patients. That was back in March, and we haven't had any since. So we've been extremely fortunate that our infection control and everything else is really working. And I think people don't want to leave that.
I think that's one of the important things that we're learning the longer this thing goes on, is that there are things that do work. And that was hard to say in March and April. And even into May and June, you know, there's still a lot of risk. But as the time continues, we can start to see evidence that our efforts are paying off when we're doing them correctly with the social distancing, the masks, and that sort of thing. There was a curiosity from Linda in the chat about Michael's house, and that it sounds wonderful. And is there a waiting list, or do you take insurance for Michael's house?
Yeah, that's a good question. No, there's not a waiting list at this point. And the program does not, well, it does not take insurance. It's not licensed as a residential program. So it doesn't, you can't use in-network residential benefits. However, what we have done that's pretty creative is 3 hours a day are considered IOP level groups. So we bill for those groups. So you pay room and board, and then we bill for basically 15 hours a week or 9 hours a week of IOP level groups. And so that really helps offset cost. So no, it's not all in network. Part of it is, and other part is not. So please, if I give you a call, I'm happy to connect you and talk to you some more about the program.
And we'll include Dr. Groat's contact information in the follow-up email as well. So I think on that note, I'll pass things back to John, and we'll close up with a few minutes before our next Zoom call that we'll probably all be hopping on at 4 o'clock. So I really appreciate this.
We all get a bit of a movement break, I hope, between
That's right.
now and our 4 o'clock. Dr. Groat, thank you. Dr. Fialk, thank you, as well as Sarah, for this important conversation today. Just real quick in closing, it's a nice segue in terms of where the conversation was beginning to go. We're going to be coming back together next Thursday at 3 o'clock to talk about the hybrid treatment experience. In particular, how we're looking at this. We have about 60% of our client base is on site in person. The other 40% is zooming in, if you will, remoting in. And how can you utilize certain technology to really support that hybrid experience, the continuation of the social connection? I think for many of us that went virtual, we're finding it was almost easier to be 100% virtual than it is to support this sort of hybrid dynamic. So how can we do this, you know, effectively, and ensure that the folks that are remoting in have a similar client experience? The following week, July 24th, we'll be with Joanna Lilly and Adrian Frumberg, two educational consultants, talking about how college can wait, and some different therapeutic gap year alternatives that are coming online. So with that, I wish you all well in the continuation of your week, and thank you all for joining us.
Yeah.
Is there any way we could share contact information, like who participate?
Vicki, we don't normally do that with the entire group, but I will be sharing the slides and you will be able to contact Dr. Groat. And I also will share Susanna Lewis's contact information, who is Dr. Groat's marketing specialist.
Okay, thank you.
Thanks, Vicki.
Okay.
Thanks, guys.
Take care.
Thank you, everyone. Great to see you. Good to see you, Kim.
Bye-bye.
Okay, bye-bye.